you know what? This is a nightmare. And you might, as a layperson, all due respect, you might think, why is this a nightmare? I just want to know if this person's a plastic surgeon or not. It is a nightmare to find out, really, the nubbins of it. I struggle. If you say to me, is this person a plastic surgeon? I'd have to do some research and, try and piece it together. And it's a nightmare. And I've written a book on it. You might think, why have you written a book on it? I've written a book on how to choose a plastic surgeon for your cosmetic breast surgery. Never accept a lift from strangers. Available from all good bookshops. Actually, I don't think it is actually available from bookshops, but it's available from Amazon, or my website, neveracceptaliftfromstrangers.com. Anyway, plug over. But why have I written a book on it? I've written a book on how to find a plastic surgeon. Surely it should be easy, but it's not easy because of this sort of stuff going on. People are like, oh, I don't know if he is. I think he is. He's not. America has got this thing, board certified. They've got a thing, board certified, board certification for a specialist. So you go on the American websites and they all say, look for a board certified plastic surgeon. Boom. Pithy, to the point, you know where you are, board certified plastic surgeon. We need something like that because we haven't got something like that, because that is just easy then. This question would be, in America, how can I tell if my surgeon's a plastic surgeon? Well, look to check that he's board certified plastic surgeon. Next question, move on. In the UK, it's not like that. It is a bit of a nightmare. Now, the FRCS PLAST thing, because I think I might have said in one of my lives, look for FRCS PLAST. The problem is the things that I say are things to say to you to look for plastic surgeons. The problem is not. So, for instance, FRCS PLAST. If someone's got FRCS PLAST, they are definitely fully trained. They've finished their training. They've got the specialist fellowship with the Royal College of Surgeons. But as you say about this grandfather thing, some surgeons were around before they did FRCS PLAST and might not have FRCS PLAST and still be plastic surgeons. Now, I have to say, this is going to be quite a senior surgeon, because there's FRCS PLAST has been quite a while, but there are some senior surgeons who are not FRCS PLAST but are still fully trained plastic surgeons. So the next thing, consultant plastic surgeon in the NHS. If you've been, or if you are a consultant plastic surgeon in the NHS, boom, you have to be fully trained. So that's another nice way of looking at it. You say, look, if someone's a consultant plastic surgeon in the NHS or has been a consultant plastic surgeon in the NHS, they're fully trained. The problem is, I left the NHS, so I'm no longer a plastic surgeon in the NHS, but I used to be. I had a full-time substantive NHS consultant post. The problem is there are some people out there who finished their training and didn't get an NHS consultant job and have gone straight into private practice. So there are people there who have also finished their training but haven't got FRCS PLAST. There are also people from overseas who maybe have got NHS consultant jobs who haven't got FRCS PLAST. They've got an equivalent. So that is the problem. The problem is nothing's 100%. Everything I say is not 100%. Like FRCS PLAST, yes, they're a plastic surgeon, but there are surgeons out there who haven't got FRCS PLAST. BAR used to be called BAPS, British Association of Plastic Surgeons. BAPS now BAPRAS. BAPRAS and BARPS are the plastic surgery associations. You have to be a plastic surgeon to be a member of them. You can be an associate if you are an ancillary specialty like ENT or something, if you're doing rhinoplasties and things. But broadly speaking, if someone's a member of BAPRAS or BARPS, they are a fully trained plastic surgeon. So this surgeon that is in question here is a member of BAPRAS and BARPS and ISAPS. I'll talk about ISAPS in a minute, but that means they're fully. So I think this guy is okay. He is a fully trained plastic surgeon if he's a member of BAPRAS and BARPS. But you don't have to be a member of BAPRAS and BARPS. It costs thousands of pounds every year. You have to pay a subscription in there. And there might be some plastic surgeons who say, well, why do I want to do that? I don't want to be a member of those guys. I'm not paying them all that money. So you can still be a plastic surgeon and not be a member of BAPRAS and BARPS. ISAPS is the International Society of Aesthetic Plastic Surgeons. And again, they will only take people who are fully trained plastic surgeons. So if someone's a member of ISAPS, they're fully trained. These associations, you have to have 2 full members to, put you up for it, like, recommend you. You have to have, same with BARPS, you have to have and maybe BAPRAS as well, I can't remember. So, but you have to be sort of, you know, like a gentleman's club. What is it? Introduced sort of thing. So this person in question is a member of BAPRAS, BARPS, and ISAPS. So this guy's a plastic surgeon. He's not got FRCS PLAST. That's fine. He's obviously a senior surgeon who was there before the FRCS PLAST. So how do you tell if someone's a plastic surgeon? Well, you look for BAPRAS, you look for BARPS, you look for ISAPS if they are a member of any or all of them, or they are a fully trained plastic surgeon. But they could be a fully trained plastic surgeon and not be a member of them. You look for FRCS PLAST. Again, if they've got it, they're a fully trained plastic surgeon, but they could be fully trained if they're old. They'd have to be pretty old, to be honest, to not. If they're old, if they're not old and they're not FRCS PLAST, then they're not a plastic surgeon. Or if they're FRCS something else, like GEN, that's general surgery, or ORL, that's ENT surgery, or ORTH, that's orthopedic surgery. If they've got another specialty in brackets, that means they're trained in that other specialty. Look for an NHS consultant, someone who is or has been an NHS consultant. But again, some people never were NHS consultants and went straight into the private. Some people you were NHS consultants and left. So I don't know what to say. It's really difficult is the answer. Do your research. You can look if someone's, the other thing you can look up on the specialist register. That's the other thing actually. So you go to gmc-uk, I think it is .org, the GMC, and then you can put in there, if they've got a funny name like me, you can put in their name. We're encouraged to give our GMC numbers out freely. 411-7214 is my GMC number. So you can go on the GMC website, gmc-org, sorry about the train, .uk, GMC, what is it? GMC, anyway, just look for the GMC, GMC dash org .uk, I think it is it? Got it wrong? No, got it wrong. Okay. Anyway, go to the GMC website and you will -uk.org. There you go. Go to the GMC website and there's a little thing in the corner saying check. Yeah, search the register. There it is. Search the register. And then you put in their name or their GMC number, and if they're on the specialist register, that means they've finished their training, and it'll say specialist register for plastic surgery from and then the year, or they'll either be on the specialist register or on the GP register. If they're on the GP register, they're a GP. If they're on the specialist register, they're a fully trained specialist in a specialty. If they're not on the specialist register if they're not on the specialist register, then they're not fully trained in a specialty in surgery. And the reason I wrote the book and the reason why this is an issue is because you can do surgery on people and not have any specialist training. That's the problem, that there's no sort of law against it. Everyone thinks, oh, there must be a law against it. No, there's no law against it. Anyone can just leave I guess they have to have done the NHS for a bit, leave at any point of their training and just go into the private sector and say, I'm going to do surgery. Now, one thing is, if you go, that's the other thing you can do. If you go to one of the big hospitals like Spire, BMI, Ramsey, Nuffield, the big companies that have hospitals all over the country, you can only work there if you are fully trained and if you're basically the equivalent of an NHS consultant. So if you go to one of those hospitals, then you can be reassured. The problem is if there's someone just working in a clinic, or some of the cosmetic companies have got their own hospitals, so they can choose who they give practicing privileges to. So then you can be less assured of them being fully trained. But certainly the major ones, you have to be fully trained. So that's the other thing you can do. But unfortunately, it's a messy answer. I'm not happy with my answer. It's a messy answer. It's a messy field. It's a messy subject. I've written a book on it because it is so messy. I wish it was easier. I wish I could say you've got a plastic surgeon by doing this, boom. But it is not easy at all. And it's pathetic, really, if you think about it. And then all these people come back and they say, my surgeon wasn't a plastic surgeon. It's all gone wrong. And I only realized afterwards. And you can't blame them. You can't blame the patient, because it's so hard to tell whether you're a plastic surgeon or not. And I think the problem is they limited the numbers of plastic surgeons years ago. So there's not that many plastic surgeons in the country. And so obviously a lot of other surgeons have taken up the slack and are doing the work. But well, that's the other thing I'd say, actually. The other thing I will say is, and talk about this in my book, is that just because someone's not a plastic surgeon doesn't mean they can't do sort of some plastic surgery procedures. ENT surgeons do a lot of rhinoplasties, for instance. So they don't have to be plastic surgeon to be doing the work. But the main problem I've got, and sometimes you come up to, and the ENT surgeons call themselves facial plastic surgeons just to get the word plastic in, but they're actually ENT surgeons. The problem I've got, or not the problem, but the thing I think is that they should tell, or at least patients shouldn't think they're plastic surgeons. I see people all the time who say, "Oh, my plastic surgeon this or that," because the numbers are so small of plastic surgeons in the UK. If you said to me, "My plastic surgeon's this," and gave me a name, I would probably know the name. I'd probably know the person. I may not know him personally or her, but I would know the name. And sometimes say, "Oh, my plastic surgeon so and so." I'm like, I don't think they're a plastic surgeon. I don't know that name. I don't know who that is. So there's a lot of people out there who are doing this stuff who are not fully trained plastic surgeons. In fact, I go so far as to say the majority of the work is being done by people who aren't plastic surgeons. And that is the world we're in, people. But it's good that you guys are looking into it and asking these questions. I'm just sorry I can't give you a lovely, nice, succinct answer like the Americans. Boom, board certified. You know where you stand. But that's where we are. We haven't got it. FRCS PLAST is pretty good, to be honest. Look for FRCS PLAST, but then you get this fella who's not got it, and everyone's saying he's not a plastic surgeon, but it sounds like he is if he's BAPRAS and